welcome viewers and listeners. Welcome back to our Eyecare Experts Podcast. Thank you for tuning in again and listening, and anybody who's new, we appreciate it. We're trying to go through certain topics dealing with the eye, and like us, hit us with any questions that you have, but we're going to jump right in. The topic for today is Eyecare Emergencies and first aid in dealing with those eye care problems.
I agree, and we have a special guest today, Dr. Andrew Sahawneh, who's residency trained in this type of thing and has a lot of good information to impart.
For sure. Yep. Well, I guess what you, in general, and you can kind of start it off, what would you tell parents that say, hey, I have a kid who's playing a sport, sort of thing, as far as what to look out for, or if they have something that happens, how to kind of deal with it?
Well, taking the second part first, if something happens, I always like to be on the safe side. My logic is always very basic. You only have one set of eyes. If you think something is important or it's not important, bring them in and get someone to check that, whether it be us or another clinic, so that you can have peace of mind and you know what you're doing. And regardless of how important or unimportant you think something is, I would get it checked.
And we have a number of patients who work at places that metal strap, and we get, or either chemicals or around stuff every day that things could happen. So
definitely.
Yeah. I mean, what would you say, or, if something happened like that, let's say they're working and they get a chemical in the eye, what would be the best way or best thing to do at that point?
Definitely the number one thing is flushing the eye. You want a solid 15 to 20 minutes of flushing the eye, preferably with some kind of saline flush, or if you don't have access to that, just going to the sink, getting some tap water, and almost any kind of, I don't want to say fully drinkable liquid, but any kind of liquid that, instead of just leaving the chemical, because depending on the chemical type, it could cause some devastating complications to the eye for sure. And so you want to do that immediately before you even call 911, before you call your eye doctor. You want to flush, and then have someone else, or after you're done flushing, make that call.
I know in school we were taught, we always thought acids could be the worst, but with the eye, sometimes base solutions can be even more devastating than an acid.
Most correct. Yeah, basal, if the pH is above 7, the tissues tend to melt. And once they melt, they're very hard for the body to reproduce, as opposed to an acid solution that is a pH below 7, where the pain will be more acute, but the damage will be fixable quicker.
Very limiting damage. And just a few things like ammonia, household bleach, oven cleaners are examples of the bases or the basics chemicals that can get in your eye, versus things like vinegar, battery acid, even nail polish remover, more acidic, and there's going to be slightly less complications to the surface of the eye with that splash.
But I think, going back to what you said at the beginning, the most important thing is if something gets in the eye, you need to be seen. We certainly talk about treating it, do what you can, with saline or the eye flushes, but, we're open Monday through Friday. We have some offices open on Saturday, and we certainly, even though we may be busy and booked out for this is an emergency. Give us a call. We've got 5 locations, and we're certainly going to try to work this patient in to be seen, if not that day, as soon as possible. Because these things, certainly if it's painful, causing redness, we need to treat that. If it's, we want to certainly limit it, get the patient feeling better, but also limit any potential, damage down the road to the eye.
Yeah, because oftentimes treatment is just, over-the-counter drops, but it could be as far as amniotic membranes or serums that we make with the patient's own blood to heal the eye.
I know I have quite a few patients, I think it'll probably at least a few a month, that come in that are working at a metal shop or grinding something in the body shop or something like that. And we're pulling metal, pulling fiberglass, pulling things out of the eye, the cornea. And I always tell them, and a lot of times these are tough guys too that don't want to come in. They're, it doesn't hurt me that bad. But if you leave it in the eye and the cornea, the epithelium grows over that, it's even harder to remove later on. It'd be much easier for them to come in, right after the incident than wait a week or a month for the cornea to grow over and then us have to kind of dig into the cornea to get something like that out.
Yes, more room from scarring. And then definitely want to cover with some antibiotics just to limit any kind of potential infection.
What do you see most often as far as coming in? Do you?
Well, I had two today were metal foreign bodies that I took out. He'd had them in, but he'd had them in before, and then intermittently it would give him symptoms. So it bothered him the first day when he got it in, which was Tuesday, and then it got a little better Wednesday, and so he stopped and didn't come in, and then it got worse during the week and over the weekend, so he came in today. So the idea that you can judge the severity of a complication by symptoms alone is false logic. So again, you have to have it checked. Some things create a lot of symptoms, yet other things don't. You have to watch for that.
We talk about certain keratitis, like contact lenses. Some people their cornea is desensitized anyway, and just because it's not painful doesn't mean it's not urgent or not important to look at. Just because it hurts you more than it hurts me, it still could be devastating. So, you still want to get looked at.
Yeah, the macho principle comes in here, especially with males. I can take this and let it ride. And it's seen as a form of weakness when you can resist or you don't resist getting treatment. And that's unfortunately a cultural society thing that needs to be changed.
Well, after, certainly treating what happened is important, but I always tell patients this too: if it causes an abrasion on the cornea, it disrupts that epithelium somehow, all this bacteria and stuff wants to invade inside the eye. And so you want to prevent the initial what happened, but also to make sure there's no secondary infections that could lead to sometimes even worse things down the road if it's not treated and things get in the eye and causes a secondary infection.
Yeah, I agree with all that. And to add a little bit, just the eye is basically a bundle of nerves as part of your central nervous system, an extension of your brain, if you will. And there is no recovery of that. So if you have nerve death, and I always portray this as a metaphor to my patients, that if, say you have tooth pain and you ride on that for weeks or months at a time and that pain goes away, it's usually not a good thing. That's just because that nerve is dead. A dead nerve in the eye is not a great thing in regards to your vision.
Well, the question is, when should a patient call us, right? I mean, when should they seek care? And I think we certainly err on the side of precaution. If it's bothering you, if it's hurting, and it's still red, and there's come in. I'd much rather tell you, hey, everything looks good, than it be something serious that turns into more down the road that we could have treated initially. So, come in. Even if you're tough, if something like that happens. I've had even cases where a patient maybe was playing softball and got hit in the eye and didn't think anything of it until months later. Certainly they had orbital issues, and it showed up later on. So things that could have been probably discovered if we'd have seen that patient and looked at the eye completely. So don't think it won't happen to you. It happens to all of us. Even if you're wearing eye protection. I have patients who come in that are, weed eating the backyard or cutting this or cutting that, and, it doesn't completely cover, and you get sand or rocks or things thrown at you. So certainly give us a call or come in.
80% of the accidents that occur to the eye that result in serious injury could have been prevented by the use of safety glasses, something that simple. The worst day for emergencies and accidents is July 4th. Due to fireworks, and that's still the number one cause of eye loss in pediatric cases in the United States. It's just unfortunate and preventable.
Yeah, so I mean, when you think something's not going to happen, I know I was actually cutting my lawn this weekend, and I do anything like weed eating or edging or anything where sand or anything could be kicked back at me. Certainly, protection, because the time you don't wear it is the time that something will happen. We're going to move on. I guess, a few things, and certainly you guys just weigh in at all points, but I guess the first question we have from a patient here is, if I have an eye emergency, can you see me immediately or after hours? Both of y'all, or one of y'all can, what do you think?
Go ahead, Andrew, take a shot.
Well, I appreciate it. Our goal is to see you immediately, if potentially. If it's an emergency, a true emergency, which there's not many conditions or causes, etiologies to cause a true ocular emergency, such as a chemical burn, a orbital cellulitis or endophthalmitis where the entire eye is infected, or even acute angle closure. Those all need to be handled very, very quickly. So our goal is to get you in and seen immediately, same day, hopefully that same morning or afternoon. And if not, our recommendation is to get to the ER so they can be evaluated and then referred to an eye doctor. But our goal definitely is to see that patient as soon as possible.
We have the diagnostic capability to differentiate between those that may not be true emergencies and the other, and that's very helpful. So we can determine one that has to be seen that day and make that clear to the emergency rooms. And to be honest with you, usually with our base, we refer to Baptist Hospital, and their emergency room knows us and know if we send it over with that recommendation that chances are it will require a specialist services.
But to that point, and just got now, if you go to a hospital or urgent care, you can do that. But a lot of times they don't have the slit lamp, or they don't have the instruments that we have that can, look at the eye or see in, and we have oftentimes a lot of stuff on hand to treat right then and there. So, we'd love to see you. Certainly, give us a call. TerrezzaOptical.com. You can go on there for, show their locations, give us a call. We'll try to get you in as soon as possible with any of those conditions, or if anything happens with yourself or your kids or loved ones, anyone like that, or at work. And we do, the other thing is work comp. We work with all of them as far as getting, these patients in for their job, especially if it's something that happens at the work site.
Well, a lot of these specialists are booked months in advance, so it's very hard to get into them. So that's the whole purpose of primary, secondary, and tertiary care. You go to the primary first, and he determines where you are, and the technical word is triage. That means he looks at it and decides whether you should go to the secondary or the tertiary care provider, tertiary being at the top of the pyramid. But unless you know what you're doing and you go to the tertiary first, then it's a misuse of the system, because many of the ones that see the tertiary were really ones that could have been handled by the primary, thus leading to a backlog in patients being seen, which is very inefficient.
We talked already a little bit about, foreign bodies, metals, plastic getting in the eyes. I think that when we're talking about this topic, the one thing that worries me is things shot at the eye. Let's say we talk about a rock or something shot out of a machine and hit the eye. And when you talk about a penetrating, something that gets in the eye, as far as that, where it gets to where there is actually a hole in the eye and fluid draining out, that's some serious stuff there.
Definitely. Yeah. If you have a open globe, which I experienced during residency, unfortunately, a kid punched his mom so hard that one of her globes, her eye ruptured and open. We had to patch the eye and fly her out to go get emergency surgery. Yes, some of those are disparaging and can lead to instant vision loss. Which brings me to my one question I had for you guys is, in addition to that question that you talked about, if you have an eye care emergency, should I be seen same day? Those are for symptoms such as pain, redness, vision loss, or big changes in vision, flashing lights and floaters. Is there anything else that you would say is an emergency type symptom for them to call same day? Or is that pretty much covered?
Did you say like a chemical spilled in there? You include that?
Yeah, well, I'm guessing that'd be pretty painful and red once that happens, but.
Yeah, I mean, I don't know if I'd add, but if they call us, give us a call. Whoever they're talking to on the phone should be able to ask the pertinent questions to determine, hey, is it, triage them and see if it is urgent. But I always tell patients, if it's bothering you, it's bothering us. Give us a call, and if we don't work you in that same day, we'll certainly get you worked in as soon as we can, and get the problem addressed and get it treated. And if it's something that we cannot treat, and let's say it's something that requires surgery or something like that, we're also going to get you referred to the appropriate specialist that you need to be seen. And we've been in this area for a good while, many years, and we have certainly a first name basis and know all the specialists that we could get you referred to. We usually can get you in pretty fast to be seen by them.
I agree. I had a lady this last Friday who came in, and she had intermittent pain in the right eye, but would go away for weeks at a time. So her primary care doc was seeing her and had given her some pain pills and other stuff, and it was still becoming intermittent. And come to find out, she'd had brain surgery a number of years ago, and she said this reminded her of that. When I tested her side vision and I looked at her nerve, and we have a machine called an OCT, which layers the nerve, there was some swelling only on one side of the nerve. And so based on that, I sent her to Emerald Coast Neurology. And 2 days later, they did emergency brain surgery on her. This happened this week, and the daughter came by to thank me. It was very nice today. And she was seen. Now her vision will be down from that surgery, but we're going to wait 6 months till all that swelling goes down and hopefully get her to see with a prescription, but that's unknown at this point.
Well, that takes me back to, I mean, that's something we don't see every day or every week, but that does go to the effect of why we want to look at the health of the eye for every patient, and why we dilate them, and why we do scans, and why we ask all these questions that probably, based on your systemic conditions, what medications you're on, and why we do all those things, because we not only want to get you to see the best we can, we want to make sure the eye is healthy, make sure the back of the eye, the optic nerve, the vessels, everything from all these systemic conditions that can cause problems are okay. Because if that's not okay, sometimes the vision's not good. And a lot of patients dismiss some of these things, and certainly you can go places and just get you some new contacts or glasses, and we do all of that, but we also want to do the other part too and be a complete eye care provider.
Necessary is the word I use in addition to complete, because without those tests, if you haven't found out why the vision is distorted, decreased, or strange to the patient in any way, shape, or form, then you haven't done your job with full responsibility and full care of the patient.
Right. I mean, when a patient comes in with blurry vision, it could be their glasses. It could be the prescriptions change. It very well could be. But it could be a list of 20 other things wrong with the eye too. Cataracts, maybe there's retinal edema, maybe there's corneal edema. There's so many things it could be. And if you don't look at everything as a whole, how could you really answer that question and find out, why the patient cannot see and why it's blurry?
Well, you don't.
Yeah.
That's what happens.
And then you could furthermore extrapolate that. Like I had a patient, since you're bringing up some stories, a patient that came in saying my vision went out. And I said, went out or is bad? Like went out. Come to find out it was a central artery occlusion of their retina, went out, basically a stroke in the eye, sent her for a stroke workup and to the retinologist. And but the neurologist was doing the stroke workup, found multiple deep vein thrombosi in the right calf, a close pulmonary embolism, and then a couple clots in the brain after they did the whole body. So basically a ticking time bomb, but the first one popped in the eye, so we caught that one early, but we were able to find the other ones and stop it and put slow it down.
One more question I've got, we'll go ahead and since we've got a little bit more time left, is what is the best way to treat styes, hordeolums or chalazions, and should I be concerned if I get them frequently? Just talking about styes and things.
Well, there's a lot of homemade remedies on that one.
Yes, there you go.
And I suggest you try all those first so you can save the $10 on your deductible for a visit. Not. So do me a favor and come in when it's earlier and smaller. It's the campfire analogy. So put it out when it's a small campfire as opposed to half the lid and the side of the face swelling up and waiting for that before you come in.
If you can't get in, the most basic and really one of the most effective ways is just warm compresses. You want to add some heat for about 10-15 minutes to the affected area and then do a quick massage on that area right afterwards. Most of them are self-limiting. They're going to go away with or without antibiotics, but a lot of times for the bigger ones, especially if they spread, you want to add that with some antibiotic coverage on top.
And they can get big. They can get
and
big.
If they spread, then they get into the orbit and everything else,
and
then it gets
cellulitis,
then it gets crazy.
So it's back to the original things. If you let it fest for a long time and don't get arrested, it can get worse as you go.
And to answer the second part of that question, I wouldn't be concerned if you get them frequently, but there's definitely an underlying disease process that's going on, something like myobonitis, meibomian gland dysfunction. One of the glands of the eyelids are dysfunctional, and there are simple ways to treat that and get that fixed.
Well, I want to thank everyone for listening and watching. We certainly appreciate it. Certainly like us, comment, keep the questions coming. We're going to have future shows, so we certainly take all that into account as far as topics or questions that we can address or try to answer on air. Don't forget we have 5 locations all around Pensacola and currently one in Alabama. You can visit us at TerrezzaOptical.com. We'd like to thank Andrew Sahawneh for joining us for this episode.
I have nothing else to add.
Thank you for allowing me to be here. I appreciate it. It's a great honor.
We enjoyed it. Thank you very much.